I am Dr. Laria Basan, postgraduate resident of I Unit 2. Today, my topic of presentation is draping for intraocular procedures. The procedure of covering patient and surrounding areas with a sterile barrier to create and maintain sterile field during operation. Draping creates an area of asepsis called sterile field created by placement of sterile sheets in a specific position to maintain the sterility of surfaces. Patient and operating room bed covered with sterile drapes. Objects draped include instruments, tables, trays, and some surgical equipment. What are the draping materials? These are selected to create and maintain an effective barrier that minimizes the passage of microorganisms between non-sterile and sterile areas. They should be effective. They should maintain isothermic environment appropriate to body temperature. The fabric material must be penetrable by steam. They can be reusable drapes. These are steam sterilized, and disposable drapes are prevents bacterial penetration and fluid breakthrough. They are soft, lightweight, compact, moisture resistant, and non irritating. Lightness and compactness of synthetic drapes prevent heat retention by patients. It reduces the hazards of contamination. Plastic incisional drapes are impermeable polyvinyl sheeting which are available in the form of sterile pre-packed surgical drapes. Incision is made directly through the adherent plastic drape. It facilitates draping of irregular body surfaces. In standard drapes, we have plain sheets used to cover instrument tables, operating tables, and body regions. Sheets should be large enough to provide an adequate margin of safety. Slit sheets are used for draping, leaving the operative side exposed. Draping procedure is to carry the folded drape to the operative site where the drape is carefully unfolded and placed in proper positioning. Protect the gown by distance and the gloved hands by cuffing drapes over them. The scrub nurse should have all parts of the drapes under positive control at all times during placement. Draping is always done from sterile area to unsterile area. The scrub nurse should never reach across an unsterile area to drape. Do not flip or shake drapes. Rapid movement of drapes creates air currents on which dust and droplet nuclei migrate. Shaking a drape causes uncontrolled motion of the drape, which may cause it to come in contact with an unsterile surface. Drape the incisional area first and then periphery. What are the aseptic techniques? Handle the drape as little as possible. Never reach across the operating table to drape the opposite side. Hold the drapes high enough to avoid touching non-sterile area. Put the drape directly over the proper area, then drop it down where it is to remain. Never adjust any drape. If drape is incorrectly placed, leave it in place and place another drape over it. In unfolding a sheet from operative side towards the foot or head of the table, protect the gloved hands by enclosing it in the turned back cuff of the sheet. If the drape becomes contaminated, discard it immediately. Thank you.